let's first talk about body mass index. We call it BMI for short. Now, when it comes to BMI, the way I want you to think about it is a very simple way of checking if your weight is in a healthy status or not. I particularly like BMI because it's really easy to calculate. Everyone can do it straight away. It's basically your weight in kilograms divided by your height in meters squared. So the main reason that I particularly like BMI is it gives us a really easy way to figure out if you are in an overweight category or obese category, because both of them have very strong links to increased blood pressure, increased risk of cardiovascular disease, and also increased risk of type 2 diabetes. But it is really important to make sure that you have a working weighing scale. I have seen it so many times in my very own clinical practice. I ask patients for an up-to-date weight. They're using their weighing scales from 30, 40 years ago that was passed down to them. And unfortunately, the weighing scales are not giving accurate readings, usually showing less weight than they actually are. And that's obviously going to give us an incorrect BMI reading, okay? So we don't have an accurate representation of their BMI, so we don't know what their health status is like. Now, it is important to remember though that BMI is just one measurement, okay? It doesn't take into account things like your muscle mass, okay? I actually did my dissertation on BMI, so it's an area which I am very clued up on. Unfortunately, it doesn't look at that, but overall it is a good indicator. Now, if you do want to find out more things about your body rather than just your BMI, you can find out things like your muscle mass, your visceral fat, your body fat index by using the A&D Medical body composition weighing scale. So it's able to give you your weight, of course, but also all of your body composition, like your muscle mass, like your visceral fat, like your body fat index, and it's all nicely put on charts, so it's easy for you to read. It's connected to the A&D Heart Track app as well, which makes it super simple for you to monitor it. So I guess the next question is, why does being overweight increase our blood pressure? Well, when you're carrying excess weight, your heart has to pump a lot harder to move and circulate that blood around the body. And this increased workload puts additional increased stress on your blood vessels, which basically causes them to narrow, increasing the blood pressure. And this is the major reason why those who have a higher BMI generally have a higher blood pressure reading. And basically, the more weight that you carry, the greater strain on your cardiovascular health system. A&D Medical, discover precision.